Is there a message of necessity at the desk? There is a message of necessity at the desk. Move to accept the message of necessity. The message is accepted.
Hello, everyone, and thank you for joining another episode of Messages of Necessity. My name is Kyle Davis. I'm the Director of Public Affairs at the Empire Center, and I have the privilege to sit with Bill Hammond to discuss the Consumer Directed Personal Assistance Program, CDPAP, that helps folks be able to have caregivers in their home. There's been a lot of controversy around this bill. Why don't you give us a brief overview of what this program is and how it impacts folks?
So, as you said, it's the Consumer Directed Personal Assistance Program. I guess we should put this in the context of it's part of Medicaid. It's a form of long term care. So, it's for people who are either elderly or disabled and are not able to take care of themselves. The idea of it is to help people um, survive at home when they become disabled. And so, within Medicaid, it can pay either for nursing home care or it can pay for in-home care. And then within the context of home care, consumer directed personal assistance is an option. And the idea behind this is that instead of having somebody, an employee of an agency, come into your home, you as the consumer, as the disabled person, you can pick somebody to work for you that you know, that may be your neighbor, your friend, a relative. Um, they come and help you out, and Medicaid pays them a wage for doing that, and that's what CDPAP is. It has become just explosively popular. Uh, about a decade ago, it had maybe 12,000 people were using it, and now it's a quarter million. So it's like more than 1,000% increase in the last 10 years.
How does
Um,
that compare to other states, Bill?
we are completely off the charts in terms of the number of people using personal care generally, and in particular using this consumer directed form of it. Um, we just have by far the largest spending and the largest use of this program on a population adjusted basis of any state. And it's continuing to grow, which is, we're already at a very high level and it's growing at this rapid pace. And so this has got the attention of state officials, Governor Hochul and the health department. They're concerned about trying to manage the growth. And it became a topic in this year's budget discussion. The governor was looking for ways to cut costs, to control the growth. And very late in the process, this idea emerged of going to what's called a single fiscal intermediary. So I guess we have to get into the weeds a little bit here. Um, when you're using a home care agency, the agency's in charge of paying the caregiver. But when you're using consumer directed personal assistance and you've identified a friend or a family member who's working for you, Medicaid wants to pay that person, but they need somebody to process the paycheck, and that's what the fiscal intermediary does. It's a pretty limited role in the context of things, but hundreds of these fiscal intermediaries have sprung up in the last decade. Um, and in fact, they are. There's a lot of thinking that they're responsible for the growth because they have a financial motivation to find as many customers as they can. And so maybe you've seen on TV, you've seen ads for companies like Freedom Care where they say get paid to take care of your grandmother. That's a fiscal intermediary that's doing that advertising. And they get paid a fee for processing the paycheck on behalf of the disabled person. So there, like I say, there's hundreds of these companies. They're very minimally regulated. No one has a really clear idea of how much money they're making. The So the proposal on the table in the budget discussions was let's consolidate all of those companies into a single contractor who would do all of this payroll processing for the whole state, a 250,000 customers. Um, and that's actually what the legislature approved, in spite of really heated opposition from the consumers of CDPAP, from the existing fiscal intermediaries, and from a lot of members of the legislature. They didn't like this idea, but it happened anyway. Um, and the reason it happened anyway is it had support from a very powerful interest group, 1199 SEIU. This is a union, represents a lot of healthcare workers in the state. They have some members who are home care workers, and they and in their from their point of view, switching to a single fiscal intermediary would make it possible for them to unionize the entire CDPAP workforce, which is hundreds of thousands of workers. It would be a huge increase in their membership. It would be a huge increase in their dues revenue. And so the governor and the health department saw this as a way to maybe contain costs, and 1199 saw it as a way to expand their membership. And so their interests kind of meshed, and that's what the legislature ended up doing. So that's the big fight right now, is a lot of the existing companies, the existing fiscal intermediaries, they're being pushed out of business as of next April. They're supposed to be completely gone. The money they're making would dry up. They'd have to lay off all their employees. And the consumers are worried about this transition. They're worried that things are going to get lost when a new company takes over, and it's one company that's trying to handle a huge program, that it's going to have trouble keeping track of all the people it's supposed to be serving and the people it's supposed to be paying. I think it's a reasonable concern. There are 3 or 4 lawsuits now trying to block this process. But I guess it was last week or the week before, it was last week, right? The governor announced um, that she had picked a company to be the single fiscal intermediary. It's a company called Public Partnerships LLC, also known as PPL. And that company is supposed to take on this job. Like I say, 250,000 people are depending on it. They have until April to make it happen. And there are all these lawsuits. And there's now when the governor's asked about it, when the health commissioner's asked about it, and one of the things they're asked is, how are you going to make sure people don't fall through the cracks? And they've started to talk about maybe extending the deadline beyond April 1, giving this new company more time to find its feet and get organized. Um, there's also a chance that one or more of the lawsuits will blow things up. So it's just kind of interesting to watch this unfold, and also, like, there's a lot of money at stake. I guess we should probably point out that this program costs something like $12 billion a year. It may be more than that. So it's becoming an increasingly large share of the overall Medicaid spending.
So, Bill, what's your take? Obviously, there's concerns about increased costs from unionization, but there also seems to be potentially a challenge of the fiscal intermediaries driving up costs by signing more and more people up for the program. Although if they're eligible for the program and they need the program, maybe there isn't an issue there. What's your kind of take? Is there a better way to structure that?
So one issue with personal care, most healthcare is kind of self-limiting. In other words, you don't go to the doctor when you're not sick. You don't check into the hospital if you don't need to. And when the hospital has finished treating you, you're ready to go home, and the care stops. You don't go out of your way to seek hospital care. You don't go out of your way to seek a doctor's visit. But personal care might be something that you enjoy having. You might enjoy having somebody come into your home and help you out. And with consumer directed personal care in particular, you're talking about money coming into your household, money going to your relative or to your friend, maybe a roommate, something like that. That that's money you have through CDPAP that you wouldn't have otherwise. And so this gives a lot of people a motivation to not only to sign up for CDPAP, but to get as many hours of service as they can. So the consumer has that motivation, the caregiver has that motivation, and the fiscal intermediary has that motivation. There's an so all of those people have a financial incentive to grow the program, and it's been very difficult for the state to put limits on it. I think there's a reasonable theory that going to a single fiscal intermediary will help with that. The problem is that unionizing the workforce will push in the opposite direction. Now you'll have a union that has a financial incentive in growing the program. 1199 is very influential in Albany. They've made clear that their mission is to increase funding for this program, and it will continue to be that once they become the union for these workers. And so it's hard to know what the outcome is going to be. Is it really going to mean more cost control, or are you going to end up with a more expensive program? And I think one clue to that is how hard 1199 has worked to make this happen. They see it as a big benefit for them, and that tells me that it may not be such a benefit for taxpayers, like who ultimately pay the bill for this program.
Well, and you've done some recent work kind of outlining the amount of power and influence that 1199 seems to have over the political process in Albany, correct?
Yeah, and this was a really shining example of that. This idea did not come from the governor. It wasn't in either of the one House budgets that were put forward publicly. It emerged during the so-called three men in a room negotiations, which I guess now is two women and a man in a room. The governor, the Senate leader, and the Assembly leader, they're negotiating behind closed doors. The budget deadline is already passed. You're talking about early to mid-April. This idea bubbles up. It's a little unclear where it originated, but 1199 definitely was on board with it from the beginning, pushed it very hard, overcoming opposition from the disabled community, from the fiscal intermediary industry, and from a lot of members of the legislature. The Senate Health Chairman has said publicly that he did not like this idea, and yet it happened anyway. And I think that's a sign of how influential 1199 is, that it could insert itself into the budget negotiations at a very late stage and get a huge change to a program, a $12 billion program that had not even been on the table for most of the year. Um, there was even a moment where one of the disability activist groups described in a blog post about how they negotiated changes to this budget language with 1199. So, 1199 apparently had the kind of authority where they could negotiate with another interest group, agree to a compromise, and that compromise makes its way into the budget language. Um, I mean, I've joked around that they're almost like a fourth branch of state government because they have um, so much access and so much influence, or especially relating to the healthcare parts of the state budget.
Wow, that is a very interesting bill. You've already kind of touched on this, but what do you view as the next steps for this program?
Well, so the state seems to be moving full steam ahead. They've identified a contractor. The next step would be they've said that that contractor will subcontract with a bunch of the current organizations who are providing this program. That's supposed to help ease the transition. So that means they have to negotiate the final details of the contract. That the new PPL then needs to figure out its deals with dozens of subcontractors. Then the really hard work of gathering the data about all the people who are in this program, getting their names and addresses and their contact information, and transferring them from their existing provider to PPL. That's, I mean, a quarter million people. That's a lot of names and contact details to gather. The deadline is April 1. That's just a big job. And the thing is, there's no single entity that has a database of all these people. They're all sprinkled. Their names and addresses are all sprinkled out there with the fiscal intermediaries, who, by the way, aren't happy about this process and aren't necessarily going to be cooperative. There's a lot of potential for rocky transition.
Absolutely. Switching gears.
Something. Go ahead.
No, go for it.
Well, I mean, just today, Kamala Harris is rolling out a proposal to make home care a benefit in Medicare. And I'm still waiting to see the details of her proposal, to the extent there are details. But when I saw that, my reaction was, how is this going to relate to what Medicaid already does? Because right now, Medicaid is the nation's long-term care insurance plan, for better or for worse. Technically, it's means tested, meaning you have to show that you're poor in order to qualify. But there's a whole army of lawyers who help people rearrange their financial affairs so that they can qualify for Medicaid when they need long-term care. So Medicaid is there. It's the fallback long-term care insurance plan. If Medicare gets into the business, is it going to be replacing what Medicaid does, or is it going to be in addition to what Medicaid does? And how will Medicare deal with this issue of the rapid growth of a program like CDPAP? What constraints will it impose on the program that New York hasn't already figured out? I think that Kamala Harris is biting off a really big job if she is serious about having Medicare take over home care.
Bill, that was actually my final question, was to ask you from the federal angle what changes we're going to make. So I really appreciate those comments. Is there anything else you'd like to leave our audience with before we go today?
Just like everybody, a lot of people need long-term care before they pass away. It's sort of, most of us, it's in our future. I think a lot of us have seen it with our older relatives. And it's just a tough problem, a tough social need that we have. Families provide a lot of this care, but increasingly family members either aren't available or aren't able to do it, or maybe they're aging themselves. And so it's something that our society needs to grapple with.
Absolutely. Bill, I always appreciate getting to talk with you and learning from your wisdom. Um, for everyone tuning in, thank you for joining us, and hopefully we will see you soon on another episode of Messages of Necessity. Until next time.
For more news and analysis, visit our website and sign up for email updates at empirecenter.org. Follow us on Twitter, Facebook, and LinkedIn at Empire Center.